Hello, good afternoon, or good evening, or good morning, depending on your location. You are welcome to today's topic, your A1C level, how you can manage it. Your A1C level, how you can manage it. All right. Welcome to today's program. Hello. Hello. Yeah, hello. Can you hear me? Yeah, I'm okay. Yeah. Okay. Okay. All right. Yeah. Okay. You said it's covered. They covered everything. So what are the parts they did not cover? Right. Yeah, sorry about that. I was called from office, so that is why I have to pick up a call. I'm expecting a call back. So once I receive a call, I'm going to step outside to answer it. First of all, I don't know if you guys can hear me. Can you guys hear me? Is my audio okay? Can somebody confirm if my audio is okay? Can somebody confirm and let me know if you guys can hear me? I need somebody to tell me if uh, I want to know, can you guys hear me? I need to know, can you guys hear me? I need to know, is my audio okay? Can somebody tell me if my audio is okay? Can you guys hear me? I need somebody to let me know if my audio is okay. Can you hear me? Before I proceed, I need to know if you guys can hear me. All right, thank you, Selena. Thank you. All right, before we start, all right, I'm expecting a call from the office once more. So once I get a call, once I receive a call, I'm going to step out briefly to answer the call and then come back and continue the program. So I'm just giving you guys heads up. I'm expecting a call back. All right. So I believe you guys are okay. We shall be talking about A1C level. I'm going to be discussing about your A1C level today, how you can manage your A1C level. All right. How you can manage your A1C level is what I'll be discussing today. We all know about A1C level. This is your average. This is a blood work. Okay, you do every 3 months. I've heard some people saying they do their A1C level every 6 months, and that is wrong. Your A1C level is done every 3 months. If you're a diabetics, that is how they monitor your progress in your diabetics. Okay, it is different from your normal test that you do at home. Okay, the one you check your blood sugar levels. Your A1C level is the one you are sent every 3 months. Doctors send you every 3 months to check your sugar level, your diabetics, to see how you are progressing. That tells the doctors on the numbers if you are managing your diabetics very well. In that particular test, a lot of things are revealed about your hemoglobin test. The short form of it is called A1C test, but the full version of it is called HbA1c test. That is your hemoglobin. All right, that is your hemoglobin test. Doctors use it to evaluate the progress, to evaluate your progress if you are managing your sugar level very well, if you are responding to treatments. So, but I've heard some people say, oh, doctors send them every 12 months, every 6 months. And I say, what the hell is going on? All right. So we're going to discuss the dangerous levels about your A1C level. When it becomes so dangerous, we're going to discuss about what does your A1C level measures. All right. We all know how the test is carried out, and then the complication of your A1C level. It is too high if you are not handling it properly, and then you're going to set your goals. So these are the way, and then the tips on how to lower your A1C level or to manage it. So these are the things we shall be discussing today. Now, okay. Now, if, for instance, anybody who wants to ask a question, who wants to join the program live, can if you want to join the program live, okay, you have to click on this link and then download it in your browser, and then follow the instruction. I'm going to paste the link. This is the link. I've just posted the link. If you want to join the program live, want to come into the video or ask your questions, just download or open that link on your browser, on your phone, on your computer. Open it, and you have to follow the instruction. Okay, on entering the studio. It's going to direct you how to enter into the studio. Then I'll be notified if somebody wants to join the program for me to accept you. All right, so that is it. Now, that is the link there. So now we all know what is A1C level. Okay, if your A1C level is high, if your A1C level is high, you are at risk of let me get in touch with you. Julie, you are welcome. From Guyana, you are welcome. All right, you are welcome. So as I was saying, if your A1C level is high, okay, you are at risk for diabetes and other complications. If your A1C level is high, okay, if your A1C level is high and you're diabetics, you are at risk of other complications that follows your diabetes situation. You must make sure that your A1C levels are not high, the same way your sugar level is not high. Now your ideal and dangerous A1C level can vary slightly between individuals. I've said it before several times. If you have a friend that is diabetic and you're a diabetic, this is not the call I was expecting. I'm expecting another call, so all right. So if you have a friend that is a diabetic and both of you are diabetic, all right, both of you are diabetic. If both of you are diabetic, okay, your A1C level will vary between both of you. Both of you are not going to have the same A1C level. So if you have a friend that is diabetic and you're a diabetic, don't expect the same to be the identicals, because there might be other factors why his or her A1C level is normal, low, or high, different from yours. There are different factors that will vary your A1C level from yours and your friend, or he has other underlying illnesses which you don't have. So don't expect your A1C level to be the same if you have a family member or a friend that have the same diabetic. Okay, so there are different factors that plays a role in determining your A1C level from one individual to another. All right. Now, your A1C level test is also known as hemoglobin. Okay, as a hemoglobin. Now, what happened is that okay, all right, I've seen what you said here. So the reason why you do your A1C level test, okay, is that your A1C level test, which is your glycated hemoglobin, okay, is that it measures the amount of sugar that is attached to hemoglobin, because sugar is attracted to hemoglobin. So it measures the amount of sugar that is attached to your hemoglobin in the blood. So that is why they send it for A1C test to see the level of sugar that is attracted to hemoglobin. So they stick and attach there. That is how they find out if your hemoglobin, your A1C level is high, low, or within the range. So is the amount of sugar that is attracted and attached to your hemoglobin that is tested to know if it's within the normal range, high or low. Yetunde, you're welcome. Okay. Now, we all know about hemoglobin is a protein present in the red blood cells. Okay. Hemoglobin is a protein that is present in the red blood cells, and then sugar are naturally attached or attracted to them. Okay. It's a protein that is present in your red blood cells. Okay. So if you have a high blood sugar level all the time, then the tendency of your A1C level to be high will be the same, because you as an individual, as a diabetic, measures your sugar level to know when it is high, low, or in the normal range. Now your doctor send you for A1C level test over a period of 3 months to know how you are progressing in your diabetes management. The higher, they all go in the same trend. The higher your sugar level is going, the same way your A1C level is going. You can never have a normal sugar level and have a higher A1C level. No, both of them goes in the same direction. So the higher your sugar level, the higher your A1C level. As your A1C level is coming down, your A1C level is going to be coming down. All right. So that is why doctors use your A1C level to find out how you are responding to treatment. If you are managing your sugar level very well, if you are reducing your sugar level, they look at your A1C level test, because sugar is attached or attracted to your hemoglobin, which is a protein that is found or present in your red blood cells. Okay. So that is it. Now, I'm getting 1, 2, 3 questions here. All right, I'm going to attend to those questions. Now, let's go to what are your dangerous levels of, what are the dangerous levels of your A1C level? What are the dangerous levels? Now, your A1C test result, will represent how well your body is maintaining blood glucose by showing the average percentage of your sugar that is present in your hemoglobin. Okay, the higher the A1C level suggests a high risk of diabetes and complications. That is why I told you, if your sugar level, glucose level is high, your A1C level is going to be also going high. They all go in the same direction. You can't have one showing normal and one showing higher. No, both of them point in the same direction. So when doctors are discussing your A1C level, they may refer the estimate average of your glucose, which is your EAG. Okay, the EAG corresponds to your A1C level. That is what I'm trying to interpret. Your EAG corresponds to your A1C level, but it appears as a milligram per deciliter, which is mg/dl. Okay, so both your A1C and your EAG refer to a person's average 3-month glucose level test. All right, now let's look at the potential dangerous level of your A1C. If your A1C level is 5.6 or less, say for instance, your A1C level, Ponfa says, what is your normal A1C level? That is what I'm discussing now, Ponfa. That is what I'm discussing now. What is, the question you asked me, that is what I'm getting into now, okay? Your A1C, I'm going to make it this way. Your A1C value, your EAG value, and the potential danger is going to be in 3 different phases. Now, your A1C value, which is 5.6 or less, okay? Your EAG, which is the estimated average glucose value, is going to be 117 milligram per deciliter or less. That shows it's normal. So if your A1C, Pomfa, I'm answering your question now. If your A1C value is 5.6 or less, okay, is in the normal range. Remember, your A1C must not exceed 7%. Must not exceed 7%. So if your A1C level is in the range of 5.6 or less, with your EAG value of 117 milligram per deciliter. So I'm giving you guys I'm giving you guys both. It depends which country where you are. Okay, here in North America, we use the A1C value. In Africa, they use the EAG value. So the 5.6% or less is equivalent of 117 milligram per deciliter or less. So if your A1C level is in the range of 117 or less, or 5.6% or less, it means you are in the normal range. It means you are in the normal range. Okay. Now, if your A1C is 5.7 to 6.4%, 5.7 to 6.4%, which is equivalent to 117 to 137 milligram per deciliter, it means you have pre-diabetics. It means you have pre-diabetics. All right. Now, are you guys hearing me? Are you getting it? The normal levels, are you getting it? Yes, 0.56 is okay because 5.6 5.6 is 6. You have to come, if you convert that 6.6, if you convert that 6, because 5.6, if you convert that 6 is good. It's good. That 6 is 1. If you add it to 5, is 6. Okay, so as I was saying, 5.6% or less, or the equivalent, depending which country where you are, the continent, the 5.6, the equivalent is 117 milligram per deciliter or less, means it's normal. That is what I just posted there, means it's normal. Now, if your A1C level is between 5.7 to 6.4%, which is about 117 to 137 milligram per deciliter, that shows you are pre-diabetics. That shows you are pre-diabetics. So I believe you guys are writing it down. If your A1C level is between 5.7 to 6.4%, which is equivalent to 117 to 137 milligram per deciliter, that shows you are pre-diabetics. All right. Now, if your A1C level is 6.5% or more, 6.5% or more, which is about 137 milligram per deciliter, it means you are diabetic. It means you are a diabetic. That is why I said there's one thing you have to understand. Okay? Remember what we just said. In this number I gave you, this is your A1C level target range. Let's go to your sugar glucose range. We say that if your glucose range, your glucose must be under 7, not cross 7, which is about 120 milligram per deciliter, depending which country where you are, which value you guys are using, either 7 or 120. In North America, we use single digit. In Africa, they use double digit. So if your sugar level is above 120, it means it's high. 120 milligram per deciliter, which is 7, equivalent of 7. It must be within 7, below 7, not above 7, and not above 120 milligram per deciliter to be high. Your glucose is high. Now look at your A1C level when it is normal. You know, I told you guys, if your sugar level is going up, your A1C level is going up. If it's going down, it's coming down. Look at your A1C level. Compare your A1C level normal and your sugar glucose level normal. Your glucose level must not exceed 7, that or 120 milligram per deciliter. If it's above 120, it means your sugar level is high. Now let's go to your A1C level. The normal range is 5.6 or less, which is about 100. 5.6 is about 6. It's about 6. And then your glucose level is what? 7. All right? Just a difference of 1. Or 117 milligram per deciliter, or in your glucose, it must be 120. It must not exceed 120 to be normal. If it's above 120, it means your sugar level is high. And in your A1C level, estimated average for that 3 months, because remember, this thing is measured over 3 months. Your A1C level is average 3 months, while your glucose level is per test, per each day, per test. Each time you measure your sugar level, your sugar level must be within 7, not exceed 7, anytime, not exceed 120 per milligram anytime. While your A1C level is over 3 months, and over 3 months, if you compare over 3 months and your daily normal sugar level must be 7 or 120, it must not exceed 7, it must not exceed 120, and your A1C level is for over 3 months, and if you look at your A1C level for that 3 months, it must be 5.6 or less, which is about 6. In your glucose, which you measure every day, your glucose level must be within 7 or below 7. So difference of 1. Over 3 months, A1C value is 6. 5.6. If you convert that 6 to, it's going to be 1. Added to that 5 is 6%. Okay, that is over 3 months. Your sugar level over 3, your A1C level over 3 months must be 6% or 5.6. While your glucose level must be within 7 or below 7, it must not exceed 7 or exceed 120, because equivalent of 7 is 120. Okay, I don't know if you guys are catching it. Now, that is for every time. Your daily, every time, your sugar level must be within 120. It must not exceed 120. It must not exceed 7. That's every time. while your A1C level is for every 3 months. And for it, that every 3 months, your A1C level that measures the amount of sugar attracted or attached to your hemoglobin should be 5.6%. If you convert that 6 in, it's become 1, it becomes 6. That's over 3 months. Now, let's go to your normal sugar range is 120 milligram per deciliter, which is equivalent to 7. And your on your A1C level, estimated average for that 3 months must be 117 milligram per deciliter, while your normal glucose level should be 120. So you see the difference is not much. Over 3 months, your A1C level must be 117 milligram per deciliter over 3 months. While your glucose level, your sugar level must not exceed 120. If it goes above 120, it is high. That is every time, every day. So you could see that over 3 months, doctors check your sugar level for over 3 months and see, is it above 117 milligram per deciliter or 5.6%? Or let me just call it 6% over 3 months. So you see that your daily glucose level, when you are testing your blood, must correspond with your A1C level over 3 months. So when your glucose level, your daily glucose testing is not corresponding with your A1C level over 3 months, it means you are finding very difficult. It means you are diabetic. There's something happening to you. That is why both of them goes in the same direction. As you are treating, you are bringing down your sugar level, your A1C level for that 3 months will be aligning with your glucose level. If your glucose level is going high, it means when you go to your test in the next 3 months, your A1C level is going to be high. So from what you are seeing in your glucose you are testing every day is going to tell you what you are going to see in the next 3 months on your A1C test, because your sugar level is high. There's no way you can go for your test in that 3 months and your glucose A1C level is normal. When your sugar level for the past 3 months is always high. It's not possible. So both of them have to go in the same direction. That is how doctors evaluate how you are managing your diabetics. Okay, do I make myself clear? Do you guys understand it? Do you guys understand it? I want to know if you guys understand my explanation. Are you guys hearing me? Do you understand my explanation? Are you guys hearing me? I need a response. Okay, did you guys understand what I just explained? Stanley, did you guys understand my explanation? All right. So now, one more thing. A person with A1C level that a person with advanced diabetes will have a higher A1C level than the person without diabetes. So if you have an advanced diabetics, it means your diabetics have gone out of control. You've allowed your diabetics to cause a lot of complications in your body. A lot of things are damaged. A lot of things are not working in your body. It becomes advanced. You are going to have a higher A1C level than somebody without diabetics because of various underlying medical conditions or blood disorders that can have an effect on your diabetics management. Okay, so if you have an advanced diabetics, your A1C level is going to be much higher than somebody without diabetics. Okay, so so as you guys know, I was trying to explain that 5.6% or below, which is equivalent to 170 milligram per deciliter, indicate you have a normal A1C level. It means that person is healthy without diabetics. So if your A1C level is, I'm going to explain it in different form now to make it easier for you guys. If your A1C level is 5.6 below, which is equivalent to 117 milligram per deciliter, it means you are healthy, you don't have diabetics. Then if it is 6.5%, remember I said before 5.7% to 6.4%. So if it is 6.5% to 140 milligram per deciliter, it means you have a short-term diabetes or type 2 diabetes without any related heart disease or long life expectancy. So if your sugar level, if your A1C level is in the range of 6.5% to 140 milligram per deciliter, your long life expectancy is shortened. It means you're not going to live that much long. Maybe somebody, if you are David, you're welcome. Yetunde, you're welcome. So what I'm trying to explain, if your A1C level is in the range of 6.5% to 140 milligram per deciliter, things happens. Your long life expectancy is shortened. Okay, if you have controlled your A1C level, maybe you're supposed to live for 80, 90 years old, but because now you leave it to, you can't control it, instead of living that 70, 80 years old, you might live only 60 years old and pass on because your long life expectancy was shortened. You might have type 2 diabetes, okay, with other underlying illnesses on that range. Now, if your A1C level is 7% or less, which is about 154 milligram per deciliter or less, okay, this usually happens to people, most non-pregnant adults with diabetes. Okay, it means a woman that is not pregnancy but has diabetes. All right, then if your A1C level is at 8% or less, which is about 183 milligram per deciliter, it means people with long-standing or severe diabetes. It means you have a severe diabetes, limited life expectancy. In this particular category, you have a limited life expectancy. You're not going to live long because you have extensive additional health challenges, complications, and poor treatment response. So when your A1C level goes in the territory of 7% to 8%, your long life expectancy, in fact, you have a limited life expectancy. The time for you to live is not going to be long because you have allowed that diabetes to cause extensive damages to your organs that you are barely functioning or barely living. Okay, so your life expectancy is limited. So I'm just trying to make it clear for you guys to understand that it's good for you to make sure your A1C level correspond with your daily sugar testing. Everything start with testing your sugar level, maintaining adequate sugar level at all times. All the complications that every diabetic is getting today has to do with uncontrolled diabetes. If you control your diabetes and live a normal life, all these side complications is not going to occur. So everything starts with controlling the main target is diabetics. Are you having a neuropathic pain, all those nerve damages? It has to do with diabetes. So everything starts from diabetes. It's controlling your sugar level at all times, avoiding having all these complications. So try as much as you can to avoid your A1C level not to go in the range of 7%, 8%, because you are in the territory that is going to shorten your life expectancy. Okay. Now, if you have your A1C level indicating prediabetes, you may wish now to change your lifestyle. I've said it several times. Once you're in a prediabetes area, you still have a chance to delay the progression to type 2 diabetics or to reverse it back. Okay, or you have to take a decision at that point in changing your lifestyles. And I've told you guys what we mean by changing your lifestyles. It's not, it's about what you consume, what you drink. Okay, reduce the intake of carbohydrates and then uptake your fiber intake. It's all about calculating what goes in and what goes out in terms of your dieting then additional exercising, and then reducing your weight. So once your A1C level is in the territory of prediabetics, you still have a chance to delay the progression to type 2 diabetes or reverse it. Okay. Ask your questions if you guys have any question. Okay. Now let's talk about the complication of high A1C level. Okay. When you have high A1C level, okay, what are the complications of your A1C level when it is high? We're talking about kidney disease. Kidney disease is one complication of your A1C level. Okay. Eye disease, which we all talk about retinopathy, is a complication of high A1C level. You're going to develop an eye disease. Stroke or cardiovascular disease is going to occur if you have high A1C level. Then you have metabolic syndrome. Okay, metabolic syndrome also going to be a complication of your A1C level if it is high. And you have neuropathy. The nerve damages. Neuropathy is also going to be a complication which everybody suffers. The nerve damages and the blood vessels that are damaging. So these are the complication of high A1C level if you are not controlling your sugar level at all times. It is very important you control your sugar level at all time to avoid all these complications. The diabetes itself is not the issue. Diabetes itself is just a one word. The issue is the complication that accompanied uncontrolled diabetes. Okay, the issue is when you left your diabetes uncontrolled, what are the side complications that comes in? Those ones are the ones you have to be fair of, not the diabetes itself. And as I used to say, I used to use a phrase and say, diabetes does not kill. What kills is what is the content of that diabetes. Okay? Diabetes is just a life and death. You have to choose one. When they told you you have diabetes, you are diabetics, then you have to make a choice. Choose one. If you want to, you have to choose life or death. If you choose death, then ignore the treatment. Keep on doing whatever you are doing. It's a choice you have to make. If you choose life, then you have to stay in that path. Okay, you have to stay in those paths. There are things you have to sacrifice in order to live. So it's between life and death. You have to make the choice. All right. So diabetes itself, it kills, but it does not kill. What kills is your lifestyle, the kind of things you are doing. Are you still doing them, or you still, when you go home, you keep on cheating? You have to make those drastic decisions and sacrificing those things that cause you to be diabetics and give them up and start living a new life. Okay, so those are the complications of A1C level: kidney disease, eye disease, stroke and cardiovascular disease, metabolic syndromes, and neuropathy. These are some of the complications of high A1C level. Now, how do you achieve a good A1C level? Is by setting up goals. How do you achieve a good A1C level? You got to set up your goals. Everything, you got to set up your goals. And I've told you guys how to set up your goals. All right, setting up your goals. Get your pen and paper, write them down. Okay, how do I achieve a good A1C level in the next 3 months? What should I do to make sure that when I go for the next 3 months on my test, I will have a good result? And then you keep building on it constantly. So you got to set out your goals. Okay, in the next 3 months, I want my A1C level to be in the range of 5, 5.1, 5.2. All right, then that's your target goal. Now, what am I going to do to achieve that 5.1%, 5.2%? One, you start by your dieting. So, okay, starting from today, I'm going to still lay off from soda drinks. No matter how tasty I am, I'm going to lay off from soda drinks and drink a lot of water. Nuts, okay? No more soda drinks. Now, I'm going to start minimizing what I eat, the portion of what I eat. What I eat now, since they say I have to stay away from white, simple carbohydrate and go for fiber, you go for those fiber. Okay, and then stick to that principles of your portion control. You don't eat white rice, white bread, no matter how you are tempted, because it has to come within you to say, okay, all these food, I have to stop them. No matter how you are tempted, to make sure you stick within the goals. You eat that minimum food you want to eat. Make sure they are well balanced. Even if it's going to cost you more, you make sure they are well balanced. And then portion control, portion sizes matters. You spread them across 4 or 5 times in a day, every 4 or 5 hours. And make sure you get, stick to your carbohydrate per meal and per day. If you are confused on the intake of how much carbohydrate you take, then it limits the quantity of the food you eat by each time. Don't eat large quantity. The smaller the amount of food you eat, the less the carbohydrate in it, and the less it's going to affect your goals. And again, dieting is very important. You're going to deal with the dieting issue. And the next thing is exercising. If you are the type that doesn't exercise, you have to start exercising now. Taking a walk, going to the pitch, run around the field. If you can afford a gym, go and enroll in a gym. But exercise is very important. Exercise, if you are constantly exercising, these are the goals you set. If you are constantly exercising, constantly, say 2-3 times in a week, 1 hour each time, maybe 2 times in a week or 3 times in a week, each of that one is 1 hour, 45 minutes, 45 minutes, and you are consistent. That alone is going to take away 50% of your diabetic situation. Once you start exercising constantly, you will see different changes in terms of your sugar level. It's going to take away 50% of your worries. And then you see that you might not even be depending on frequent medications, because you are going to see the immediate changes. Anytime you measure your sugar level, you see that it's within the normal range. All right. You see within the normal, you keep building on it, and when you go for your test, you are confident that when that test comes back, it's going to be within the normal range, because you know that you are stick to the principles and you set up the goals within yourself. Stanley says, hi, I'm hard giving up due to different challenges and how I wish I passed on. But listening to you, I get a new hope. Do not pass on. Do not wish you passed on. Okay, Stanley, do not wish you passed on. Diabetes is not something you wish for an enemy. All right, I'm going to speak from the heart. Diabetes is not something you wish from the enemy, but diabetes gives you a second chance to live. I think yesterday when I was doing a live video, I said something. When you have diabetes, it gives you a second chance to live. Why did I say so? If you go to hospitals, I'm going to Stanley says something that I'm going to speak. This is what he says. He said, I have given up to different challenges and I hope I wish I passed on, but listening to you give me a new hope. And I'm trying to respond to that passing on. Stanley, why I say that I'm a diabetic. Okay? I'm a diabetic, but don't give hope. Don't give up. Okay? Don't give up. You still have, when you have a diabetes, it's a second chance to live. Can you live as normal as a diabetic? The answer is yes. You can live normally as a diabetic. All right? You can live normally as a diabetic. It's all about understanding the principles of diabetics. Diabetics has a rule and regulation that you have to abide to live a normal life. Diabetics have a language. Diabetic has a language. When you are communicating with a diabetic patient, there's a language, the way you guys communicate. Even somebody without diabetic will not even understand what you guys are communicating. But because both of you are diabetics, you guys understand yourselves. It has principles, it has norms, it has rules and regulation. You must stay within those conformity of those rules to live a normal life. When you step away out of those rules and regulation, that is where you are inviting those complications that is going to make you say, you know, I wish I passed on. And what are those rules? Is avoiding those things they ask you not to do and concentrate on those things they ask you. It's just simple. I know it might sound simple, but I know people find it very difficult. That I used to like this favorite food, but I'm going to give up this favorite food because of this diabetes. Yes, it's a price you have to pay. If sacrificing that your favorite food is going to make you to live for yourself, and most importantly, to live for your family and your kids, then give up that food. And when they say sacrifice, does not mean you cannot even eat that your favorite. You can still eat that your favorite food, but it has to be in limitation. It has to be in a smaller quantity. Very, very small quantity. And it shouldn't be constant. Maybe once in a while. Like, for instance, I'm a diabetic. I used to have a favorite food, but I have to give it up. Do I still consume those food? Yes, I still consume it, but I know how to consume those food. I know the principles to apply. I don't eat it the way I normally eat in the past. If I have to eat it, I know what portion to take, and I know when to stop. And I know when to do thereafter if I feel it's going to cause me problem. But so If you know you have a favorite food to eat, do not go and start eating the same quantity all the time. Once in a while, you can give yourself a treat, and it must be in a smaller quantity. But don't make it a habitual that it has to be every time. Okay? So the decision you are making today as a diabetic is, if you are married or you have a family, don't think of yourself, think about your kids. I'm sacrificing because I want to live for my children. I want to be there to raise my children. I want to be there for my family. I want to be there for my mom. Maybe you are the only child for your family, your mom, your dad has. You have to fight, take that battle to fight, to live for the sake of your family, your father and your mother, because you are the only child. So there are principles. Those things they ask you not to do, stay away from it. And then those things they want you to do, concentrate on it. Like exercising is very important. Reducing your weight is very important. Working with a doctor. Stop all this traditional medicine. There is no cure with diabetes in traditional medicine. Forget, you are just wasting your time. In fact, if you are stipulating wasting your money buying traditional medicine, you are killing yourself. There is no medication for traditional medicine for diabetes. You work with a doctor who is going to guide you on things to do and things not to do. Okay? The hardest aspect is about carbohydrate. Carbohydrate is what causes all these complications. As long as you can know amount of carbohydrate to take. When it comes to diabetics, the problem is carbohydrate, because carbohydrate is found in virtually every food that we eat. Even the drinks that we drink, there's carbohydrate. That is the problem that causes you to be diabetics. And even though still when you are diabetics, you are still having problem on controlling the amount of carbohydrate you take. Because that carbohydrate is virtually in every food. And once you eat it, it's going to go and convert it to sugar and spike up your sugar level. So once you understand that carbohydrate is what I have to fight for, is you have to understand the limits of that carbohydrate to take, at what time to take it, and at what quantity. Okay? Every food contains carbohydrate, and that is what is causing you spiking up your sugar level, because that food you are looking physically is sugar. In your hands is carbohydrate. But once you eat it, your body is going to break them down and convert it to sugar and spike up your sugar level. Now, as a diabetic, you still need carbohydrate to survive, because anything you do, you need an energy, and you derive your energy from that carbohydrate. That is why they say limit your carbohydrate intake. For every meal, 15 grams of carbohydrate per meal, and then per day, you have to consume 60 to 65 grams of carbs per day. When you exceed this limit, that is when you are inviting trouble. Now, the question you're going to ask me, Stanley, now is that how do I know which is 15 grams of carbohydrate, or how do I know which is 60 grams? How do I know when I exceed my limit in carbohydrate? If you are confused in terms of limit, that is why they simplify it that says eat in a smaller portion. Every 4 hours, eat. Don't eat that big giant food that you sit in your table and you finish one big bowl of food. Because that big bowl of food is sugar you are eating. So that's why it's okay. The way for you to understand it is to divide your meal over 24 period hours, 4 hours. Every 4 hours, get something to eat. In that, the first meal, make sure you have 15 grams of carbohydrate. The smaller the amount of food you eat, the smaller the amount of carbohydrate that is going to affect your sugar level. So eat the smaller amount that get the required carbohydrate and the fiber in it, and wait for the next 4 hours to eat another smaller portion. Thereby, you are rationing your carbohydrate over a period of time that is not going to affect your sugar level. Okay, so it's all about understanding the principles of your dieting, exercising, and then make sure you work with your doctor and take your medications at all times. Then, in terms of passing on, and what I said, when you Stanley, are you still there? Stanley, are you still there? In terms of passing on, I don't wish you to pass on. All you have to do is to hang in there and take the fight. You have to fight the fight. Fight the battle of your life to save your life, to live for your family. And why I say that you have a second chance as a diabetic is that If you've been to hospital, if you've been to hospital, okay, if you've been to hospital, you see that there are people lying in the hospital bed from January 1st to December 31st. They've not getting up from that bed. They are lying on their back with their legs up or with their hands up. In that bed is where they do their poo, is where they urinate. From January 1st to December 31st, they've been lying on that bed. They've not stepped up in their feet. And they've been lying there for 3-4 years. And they are still living. They are still talking. Those people who are saying, God, if I knew, can you give me another chance to live? Just if you can allow me to get up from this bed and give me another chance. So consider yourself lucky, even though you are diabetics. Okay, there are people that are in a worse situation than you are today. Okay, and they are hoping that they will let God give them a second chance for them to be able to rectify what they've done in the past. So when you go to the hospital, you see that there are people. In fact, when you see those people lying there, you say, you know what, I prefer to be diabetic. You will prefer to be diabetic and not to be lying in that bed from January 1st to that. They have not gotten off. They lie there. That is where they do everything, change their path, do everything. They've not gotten up from that bed to take a walk. And they've been lying there for 3-4 years. So you got to hang in there. As a diabetic, never lose hope. Okay? Hang in there. Do the right thing by following your doctor's instructions. If you know those things they ask you not to do, not to eat, stay away from it. Stay within the principles of diabetics. Concentrate on the norms. Those things they ask you to avoid it. And again, exercising is very important. I keep saying it. Exercising is very important if you're diabetic. Involve exercising in managing your diabetes. They are very, 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 very important and key factor. Not only that exercise control your sugar level by keeping it within the normal range. It also keeps you away from other underlying illnesses like cholesterol or high blood pressure. If you are physically active, there are certain illnesses that you can run away from. But when you are not active, you are just staying one place. That is when your body is, every small infection, your body is going to catch it because your body is active. It's not active. It can't fight off those infections. When you are active, you are building up immune system, defense immune system. You are building up your white blood cells and your red blood cells to fight off infections and bacteria and fungus. Okay, but when you are not physically active, any slightest infection that pass in, you caught it because your immune systems are not active. They are low and they are weak. So all of you that are diabetics, try as much as you can to involve exercising. Is very important. Exercising is very important. All of you that are diabetics, involve exercising all the time. It is very, very important. That will solve about 50% of your trouble if you are living with diabetics, because that is going to make sure that first of all, it's going to keep your blood sugar level in check. All right, and avoid you having other complications that comes with it. Stanley, I believe I've spoken to you the way I could, so try to hang in there. I believe you can hear me. All right, so let's. Do we have any other question? Do we have any other question? Do we have any other question? All right. I've discussed with you guys about setting up your goals. Let's talk about tips to lower your A1C level. Let's talk about tips to lower your A1C level. Okay. What are your tips in lowering your A1C level? Can you guys hear me? I need to know if somebody is hearing me. Can you guys hear me? All right. So let's talk about tips to lower your A1C level. What are the tips? What are the tips to lower your A1C level? Number one. Number one is reviewing your medications. Number one tips. I'm talking about tips to lower your sure. Sorry, I made a mistake. Let me correct it. So let's talk about tips to lower Haji from Kono, Sierra Leone. You're welcome. Let's talk about the tips to lower your A1C level. One is reviewing your medication. Number one is reviewing your medication. Okay. Tips to lower your A1C level. Number one is reviewing your medication. Reviewing your medication. What do I mean by reviewing your medication? From time to time, you may change to a different medication or increase the dosage of the current or reduce the dosage of the current medication. Okay, so review your medications. Okay, from time to time, like if you've been taking this particular drug for a year, or let's just say for 6 months, and you could notice that, okay, you've been taking it for 6 months, and that 6 months you've been to your A1C test twice, and you could see there's no difference. It's not reducing your A1C level to the normal range. Okay, then you have an opportunity to review your medication with your doctor and say, doctor, this is 6 months now or 1 more year now I've been taking this medication, and I've been to 4 A1C tests, because you do it every 3 months, and the numbers will speak for itself. See if you are with, if your A1C level is within the normal range or is still high. Then you can have a discussion. As I said, build a relationship with your doctor. Build a relationship with your doctor. Don't be a patient that changes doctor every 2 months. You go to see these different doctors or not. Establish a relationship with your doctor. When I say I'm not talking about intimacy relationship with a doctor. What I mean by a relation is that when you are visiting one particular doctor for 6 months, a year, 2 years, 3 years, 4 years, it means you've established that relationship. That doctor will now, the way the doctor is going to treat you is going to be different from when he has a new patient that is 6 months or less than 6 months, because you've been with that doctor for a longer period. So that doctor understands your head very well. Now, if you have that kind of relationship, you can be confident to call your doctor at any time. Say, doctor, I want to see you. And then you can say, doctor, I want to take a review of my medication. So we're talking about tips to lower your A1C level. So number one is review your medication. Then because of that relationship, even though you've not been with your doctor for a long time, you still have the right to go and review your medication, talk to your doctor and say, doctor, I've been taking this medication for a year now, and I could see for the past period I have done my A1C test, I don't see any changes. So can you take a review of my medication? Then doctor can do 2 or 3 things. Is either change the medication and try another new drugs, or he or she can increase the dosage of that particular drug or reduce the dosage, okay, of that particular drug, and see if there's going to be a difference in the next 3 months when you're going to do your A1C test again. So number one tips is review your medication. That is tips to lower your A1C level is reviewing your medication. And if could change a new medication, talk to your doctor about changing let's try a new medication and see if there's going to be a difference in the next test, or can you increase the dosage? Maybe you're on a lower dosage, he can increase it from 200 to 500 milligrams, or he can now he can now or reduce the dosage. Maybe the drugs, if the side effect is too much, it's going to reduce it from higher amount to lower amount. But that is reviewing the medication. And again, you have to follow your doctor's instructions at all times. I keep saying it. You have to follow your doctor's instructions at all times. Never doubt your doctor or never disobey when he asks you, when he prescribes medication. Instead of to follow the line of treatment, you go and establish your own treatment. You must listen to your doctor instructions. All right. I'm here to give you guys guidance and give you guys information. But if those that have been following me since, you could see that even those that ask me questions about their current treatment with their doctors, even some of the personal images I get on my WhatsApp, on my hair, they ask me, they share their treatment with their doctor. At the end of the day, I always tell them, refer back to your doctor. You are the right hand. Okay? I'm not those type that talks down on doctors. Okay? I'll give you my own professional advice, but at the end of the day, I will still ask you to go back to that particular doctor and listen to that doctor because you are the right hand. I'll give you my own professional advice, but at the end of the day, I'll say, listen to your doctor. But I'm not going to encourage you to go and listen to a traditionalist, a herbalist. No. Okay? I'm going to speak against a herbalist because you're just wasting your time. Your doctor treating you has the final say. I don't have the final say. I'm only going to give you my own professional advice, guide you. But at the end of the day, who has the final say is your doctor. And I used to tell them, if you're my patient, I have the final say. But if you come to me to give you a professional advice, I'll go through the paper record and say, okay, this is what I see, this is what I see, this is what I see. Let's try this. But at the end of the day, you have to seek your doctor's consent because he knows you, he has your record, he has been treating you. So he will have more knowledge than me because I don't have your medical record. You are not my patient. Okay, I'm not treating you, so I wouldn't have much say. That is why sometimes I would say, go back to your doctor. Your doctor has the final say in treating your diabetes. But I'm only going to give you guidance, give you my own professional advice, also give you my own knowledge of. I can give you hints. Okay, maybe he's wrong in this area or he's right in this area. But at the end of the day, I know how to address it. I'll say, go back. Even if I'm going to be a little bit of say, no, he's wrong in this area. I know how to put it across to you, and then you don't go to your doctor and say, this doctor say you are wrong. No, never you try that. Don't ever try that. Even though the other doctor say it, never you go back to your doctor and say, this doctor say you are not. That will end your relationship with your doctor. It's not even going to treat you. It's going to tell you, go and continue your treatment with another doctor. Even if you suspect something or you suspect, there's ways to address your doctor. You can have one-on-one discussion with you. Even if it's good to seek second opinion. Sometimes I do encourage others, go and seek second opinion. Like when I had my thyroid, I seek 2 opinions. When I went to the first doctor, he told me what I told me. I went for the first test and they discovered it. I still went to another test to make sure I have 2 opinions. If the 2 opinions are good, and when I went to the second one, it comes out the same. But the other doctor does not know that I've seek second opinion from another place. I just want to make sure that what this test says is the same thing with the other test says. So I went, get a form from another doctor, go for another lab test to make sure that what my doctor says is correct. But I did not let the other doctor know that I'm seeking second opinion. So, and when the test came back, they all say the same thing. Then I know, okay. So, but I'm not going to go, and I wouldn't want somebody to come to me and say the other doctor tell me what, because if you say that, I might not be, I know how to handle it. I might not be sarcastic as a patient. We are not allowed to be sarcastic. I'll know how to handle it professionally. Okay, but I also have the right to say, you know what? I'm going to I'm not going to treat you. The doctor have the right to say, I'm not going to treat you anymore. Look for another doctor. He might not give you any reason. He will tell you, this is the call. This is the call I'm expecting. Hold on. Hello. Yeah. Mm-hmm. 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 All right. Okay. All right. Don't start anything yet. Okay. Don't start any yet because I'm gonna talk to the other dealership and then get back to you. Okay. Yeah. Because on that part, level part, something is wrong because that is why I have a warranty. Yeah, but we're talking about the level part now. Who's going to cover the level part? Uh, okay. Let me, what time are you going to be still there before you leave? Okay, I'm going to call you back in the next, say, half an hour. All right, I'll do that. I'll call you back. All right. All right. Sorry, that's the call I'm expecting. My car has an issue, so was so they called me. So that's what I'm trying to sort out on the phone. So sorry about that. So number one tips is reviewing your medication. I've told you guys how to review your medications is uh, either changing the medication, increasing the dosage, or reducing the dosage, and follow your doctor's instructions. Now, the second tips is regular exercise. I've said several times about regular exercise to lower your A1C. Exercise in general not only controls levels or your sugar level and all that. If you are physically active exercising, anything that has to do with your overall health, you'll be secure because you won't be feeling sick all the time. Once you are physically active, your immune system is going to be strong. Okay, it's going to be strong. Your defense system is going to be strong. All these cholesterol issues, high blood pressure issues, your sugar level is always too high, your A1C level is always too high. Exercise take control of that if you are constantly exercising. I've said it before, there are thousands and millions of people who are diabetics who are not on medication. They are controlling their sugar level just by exercising and eating healthy. So exercise is very important. So if somebody have that say diabetics has been living a normal life, no complications, no not on medication, just through exercise and eating healthy. So that tells you that exercise solve 50% of your problem. All right, yeah, Joyce, you're welcome. So number two tips is regular physical exercise. Exercise is very important if you're diabetics to lower your A1C level and your sugar level. Now, the next one is healthy diet. Healthy diet is very, very important. The same thing, you must eat healthy. Once you're diabetics, you must now start eating healthy, low carbohydrate, more fiber, a lot of vegetables and fruit. Okay? Eating healthy helps you to lower your A1C level. The next one is stop smoking. If you're a smoker, you have to stop smoking. Stop smoking helps to lower your A1C level. And then the last one is you have to belong to a group, diabetes class. Form a group, diabetic group, belong to a diabetic group. There they share information. There are a lot of things. I know in most in Africa they don't have because government don't have provide those social amenities. Say, okay, this is a diabetic class. You know, they meet every once in a week or every two twice in a week. You go there, they teach you about diabetes, things you're supposed to do, share information with you, help you on your diabetes management. They don't have it in most of third world countries. The government doesn't care because of corruptions. So belonging to a diabetes group or community also help because there you will learn few things that you don't know. Like when I started this page, people don't know, I know people say they have learned a lot from, and I do appreciate it. Because there are certain things they don't know about diabetes until they start following me, and then they start learning it, and then most of them come back and say, you know what, there is a changes in their lives since they start listening, following me, learning one or two things, watching my videos. So the same thing applies to diabetic group. When you belong to a diabetic group or classes, you're going to learn things you don't know. So those are tips in lowering your A1C level. Okay, those are tips in lowering your A1C level. Okay, so now, do you guys have any question? I have one call to make. I have one call to make. I have one call to make. Do you guys have any question? Please, I'm going to make, there's a call I want to make, okay? I'm going to step away from the camera and come back and continue. If you guys can hang on just 2 minutes. 2 minutes, I'll be right back. 2 minutes. Let me make a call. I have to return this call, all right? And then I'll be right back and continue with you guys. So you said I should call it that was right. Sorry, I'm back. I'm back with you guys. I have to deal with a lot of issues in the office. Hello? Yeah, leave the result on my table. Leave it on the. I'll tackle it in the morning when I get to the office. Yeah, leave the result on my table. Yeah. No, don't book any appointment. I don't want to. Don't book any appointment. I have to see the result first, and I'll take it from there. All right. Thank you. Sorry about that. My phone has been getting off. All right. We. Sorry. Then I've been getting a lot of calls. I hope I'm not going to get another call. So we talk about the tips. I said the tips is our tips to lower your A1C level, reviewing the medication, regular exercise, healthy diet, stop smoking, and then belong to the diabetes group. That diabetes group is very important. Okay, that diabetes group is because there you're going to learn a lot of things. Okay, you're going to learn a lot of things you don't know. Like people watching me here that have learned one or two things, and I got a feedback that they're okay, they're getting better. I'm okay. I'm happy about it. But belonging to that diabetes group is very important. I know some countries, because of the government there, they don't give a damn. Okay, you're on your own. But if you belong to those diabetes group, it is very, very important. You're going to learn one or two things about diabetics. As I said, at the beginning of diabetics, it's confusing. But once you get to know everything or get information you see that treating diabetes or living with diabetes makes life easy for you. Okay, but you have to get the knowledge. The knowledge is very, very important. If you get the knowledge, understand the ins and outs of diabetes, you're going to lead a normal life. All right. I wish I can travel all the countries one by one and then give classes, go to this country, gather, all these people, stay there for 1 or 2 days, educate them, share knowledge with them. I wish I could do it, but it's going to be time consuming and cost consuming. All right. So that is one thing. Learning about diabetes is very important. Do we have any question? Do we have any question? Do we have any question? I guess all of you are sleeping already. The time difference is causing issue. All right. There's no question. All right. If there is no any other questions, I'm going to let you guys go. And when I download the videos, you guys can watch the videos later. Okay. I know I'm going to get another call. I don't want to be. Can A1C test be done with a home? No, A1C test cannot be done at home. Even though you must go. A1C test can never be done at home. Your doctor is going to book an appointment 3 months in a. If you go today, your doctor is going to tell you when to come for the next appointment in the next 3 months. They give you ahead of time. So anytime you go, you finish that test, and doctor call you when your result comes in, and doctor call you to discuss your result. Before you leave, he's going to give you another appointment 3 months ahead when to come and go and do another test. So you can never do it at home. It must be done at a lab where they take your blood, take your urine, depending on the test they send to you. Okay, so it cannot be done at home. The A1C level is specifically for doctors. That one is for doctors. That is what they use to monitor how your sugar, your diabetics, to evaluate if you are handling it properly, if you are treating it. The ones you do at home is for you. Okay, but the A1C level is doctors. That's how they monitor their patients, if their diabetes is working or is there any changes they have to do. All right, Selena, thank you. Thank you. So that is it. You can't do it. You can't do it at home. All right. Yeah, Regina, you say yes, please. What is your yes, Regina? What is your yes, please? All right. Regina said yes. What is your yes, please, Regina? You say yes, please. I don't understand what you mean. Oh, okay. All right. I guess you guys don't have any question, because I'm about to leave you guys now. 1 hour 30 minutes we've been here. Now I sent you guys a link. There's a link I posted here. There's a link I posted here. Let me just see if I have that link. No, I don't have it. Let me say it now, and I'll let you guys go, because I think I have to go and attend some few things. I'm going to let you guys go. I posted a link. You see this link I'm posting now? I want you guys to listen how to use it. Okay, I posted a link. Now, after I finish this live program, you guys, you take this link, open it in your, download it on your phone. Download it on your phone. Two ways. Download it on your phone, or you keep this link with you. When I'm live, you cannot join. Okay. You can still join, but you need this link. You need this link. So you open it on your phone, or on your laptop, on your computer, download it, or open it. When you open that link, it's going to tell you instruction on entering the studio, how to enter the studio. It's going to tell you how to enter the studio. Okay. So when you open that link, so you keep that link with you. So anytime I'm live, then you can use this link to, if you want to join the program live, If you want to ask your question live, if you want to come appear on the video, you have to click on that link. So when you're going to save that link, keep it on your phone. That's why I said download it on your phone and have it ready. So anytime I'm live, you can go to that app on your phone, that you open it and then join the program. It's going to tell you how to, because I'm already live, you're going to see it there. It's going to direct you how to join the program. And once you join the program, it's going to let me know that you are waiting to bring you in. So that is how to. So you're going to keep that link there. So you're going to download it on your phone and keep it. My last A1C was horrible, as you know, but my doctor reviewed my medication and also saw a dietitian, and I'm glad to say I'm following it strictly, including exercises, and my fasting sugar has tremendously gone down. May is my next A1C test. Good for you, Neka. Good news. Good news. I think you share. I think you shared that A1C food. Are you the one that sent me? I think somebody shared me the A1C, and I said the A1C level is high. I think somebody shared. I don't know if you had one or somebody else. Somebody shared me their A1C level, and I said no, this is high. I don't know, but I know that somebody sent me their A1C level. But good news. Good news. You are following your doctor's instructions, and you see a dietitian. Good news. So that is why I say, okay, all right. So it's very important. Good news. Follow your doctor's instruction, and that is what I preach. Follow your doctor's instructions. If you follow your doctor's instructions and guidance, you are going to be okay. It is important. Take your medications, and then exercise is very important. Exercise is very important. Exercise is very important. Okay, so I have to make one call now before we continue. You guys have to excuse me. I have to make one call. I have a lot of. You guys can ask your question. I'm here. Any other question? While I'm on the phone, I'm waiting. I'm reading your questions here. Oh.
Okay, I was just trying this.
How are you?
I'm fine,
Yeah,
thank you. How are you?
I'm calling regarding this my claim. There's a claim that I submitted now for a repair of my car. All right. But why am I so? I bought a warranty, but I still have to pay for the labor. Why should I pay for the labor? Okay. I don't have it here, but I have my contract number 2903670. Cyril. It's 2015. Whoa. Yeah. Please, today is not a good day for me because I've been having a lot of calls from work and other things. So I don't know. I can't get back to office now. Regina, you came online and then you went. Sorry about it. I was online. Regina, my apologies. How are you? How are you, Nela? How are you?
Fine, thank you.
You have a question for me?
No, but just looking on.
All right. So how are you? How are you? Are you a diabetic?
Yeah,
So what's going on with you?
not too much.
Really? Are you taking care of your situation at all?
Yeah,
All right. I'm happy to hear that. So where are you watching from?
my Kuni.
Where?
My Kuni.
Oh, my Kune. Oh, which country is that?
Yeah, Guyana.
Oh, okay, Guyana. All right. Nice to
Yeah,
see you. I'm glad that you
nice
are.
to meet
I'm glad that you are handling your diabetic situation. Okay, that's fine with me.
you. Yeah.
Today has been a crazy day. I don't know. I left office. Now they are calling me. This one is sick. This one want to see me. That's why you see me stepping out of the camera. So, but I told them, no, it's not possible. I can't come back to the office. All right.
Okay.
So you don't have any question, but it's nice for you to connect with me. At least anytime I'm live, you guys can connect live and ask your questions. So I have anything to share with
Okay, no problem.
you. Yeah. All right.
Okay then.
Bye bye.
Bye.
Yeah. All right. Regina. So, Regina, sorry about that. When you come online, I was on the phone, so I got a call, so I have to interrupt. So I did not ignore Regina Lungu. So my apologies, please. All right. My apologies, please. So I'm open. I'm open to questions. I'm open to questions. I'm waiting for other questions. If you have any questions, I'm open to other questions. Do you guys have any other question? Yeah, Pelon, how are you? Please, may I speak to Kachik? Pelon, how are you doing? Long time. Kachik, please, can you call me back, please? I sent you an email. Can you read my email and call me back, please? Thank you. What's wrong with you, Pelon? What's wrong with you? What's wrong with you, Pelon? Oh, you're having a gallstone. Wow. So are you, what did your doctor tell you, Pelon? What did your doctor tell you? Are you on medication? Are you on medication on your gallstone? Oh, you have a surgery. Oh, okay. All right. I hope you got better. I hope you got better. Sorry about that. Sorry about that. Okay. I hope you get better soon. Now, Yetunde says, please tell us, could you please tell us difference between glucose test and A1C test versus keto dog? Yetunde says, can you please tell us difference between glucose test versus A1C test? Glucose test is the one that glucose test is the one you do every day at home or even in doctor's office. That is glucose test because you carry that one at home by yourself. Okay. because you carry that one by yourself. That is the glucose test. Okay, that is the glucose test. All right. Now, the A1C test is specifically meant for doctors in monitoring their patients' diabetic progress. You, as a patient, as a diabetes, cannot order A1C test by yourself. You need a doctor's requisition form. You need a requisition form from a doctor to go to a lab and do that test. And it is done every 3 months. Doctors monitors their patients' treatment for diabetes through A1C tests. It is only carried out, instructed, or ordered by a doctor. Your normal glucose test, you can do it by yourself to monitor your glucose level all the time. But your A1C test is done every 3 months and must be requested by a doctor. Okay, and must be requested by a doctor. You cannot go and do request for A1C test by yourself in any lab test, any lab office. It must come from your doctor's office. On the term of keto, keto is the new keto is, most doctors don't use keto to treat their diabetics or monitor their patients' progress. Okay, so this keto something is an invention. I've seen other clinic using it. Okay, but the most recognized way to monitor treat your glucose is A1C test and your glucose. This keto is a new version people use. Most doctors don't rely on it. The one that doctors rely, that is bulletproof, is your A1C and your glucose test. So as a patient, you have to monitor your glucose test every day, but every 3 months you must report to your doctor for A1C test. So these are the difference. A1C test is carried out by a doctor. Your glucose test is what? Kartik, please, can you call me back, please? I sent you an email. Read my email and call me back. All right? Okay, thank you. Bye. So your A1C test must be requested from your doctor. You, as a patient, cannot go and do A1C test. That is handled by a doctor. Your normal glucose test is carried out by you. You test your glucose test all the time. Or sometimes when you go to a doctor's office or in the hospital, they try to do your glucose test to know the range of your glucose if you have an emergency. But your A1C test is specifically ordered by a doctor. These are the only way doctors keep in check, monitor their patients' progress in treating their diabetics. Keto, most doctors don't rely on it. Don't rely on it, okay? So that's so doctors don't rely on it. So on that keto, I've been hearing about it. Not all clinic, not all doctors follow it because it's not reliable. People don't use it. I see some people, try to say, go and do keto, all this and that. The most medically proven and approved method of monitoring, treating diabetics is your A1C test and your glucose test. This new invention of keto, people don't rely on it. People don't use it. I don't use it. People don't use it. So that is it. Hello? Yeah. All right. Okay. All right. Okay. Okay. All right. Thank you. Okay, Pelon. All right. I've heard you. Okay. I hope you get better. So, Yetunde, I believe you understand the difference between glucose test and A1C test. All right. Sorry, today has been very busy. So that is why you see my attentions are divided, but I can still talk. I hope you got better. All right. So I shared a link. I shared a link how you can come on live. I think two people have tried. Regina tried to come online. Another person, another lady from Guyana joined online. Okay, there's a link. You have to follow that link. You have to download that link on your phone or open it and save it on your phone. So anytime I'm going to post that link once more, okay, save it on your, that is the link I just posted again. Open it in your browser, in your computer, download it, save it. Save it, keep it handy. Anytime I go live, if you want to come on live, you just follow that link, go to that link, and it's going to and connect. Follow the direction. And you have to, first of all, you have to download it and save it on your phone, open it in your browser. Then anytime I'm live, you can go to that browser and then click and then come on live. Like two people have joined me live. So if you want to ask your question on a video, you want to join the program, you can, that's what you have to use. Or you can ask your question on the comment section. Okay, so you go to save it, that open that browser, save it on your computer, on your laptop, on your iPad, on your phone. So if you want to come on live, when I'm live, as soon as I'm live, you can just go to that particular browser, and it's going to connect you directly to my live video, and then you can ask your question or share your thought. All right, so that is it. So who again? Yetunde, I believe you've known the difference between text and A1C level. I would advise you to concentrate on both glucose and A1C level. Your A1C level is very important. Your glucose test is what you do at home every day. Your A1C level is very important. Get it from your doctor. On that keto, I cannot advise you. I can't contribute because I don't use it. I don't believe in it. Okay? So that is it. Okay, Yetunde, as I said, whatever the doctor you are, or whatever the clinic or the hospital that is treating you, whatever they advise you, fine. Follow, as I said, follow their recommendation. Okay, there might be a reason. There might be a reason why. There might be a reason why they recommend that keto test. So I wouldn't speak evil about it. So I would advise you to follow that instructions. Okay. All right. All right, I'm going to let you guys go now. Let me let you guys go. Since there's no any other question, I'm going to let you guys go, and we're going to reconnect some other time. All right. Keep watching the videos, and then leave your comment coming. All right. So I'm going to let you guys go to enjoy your evening, and then hopefully we're going to meet sometime tomorrow again for another program. All right. Sorry about that today, about my phones ringing, because I'm always very busy. They need my attention. So, but my apologies for today. I hope next time this is not going to reoccur. All right. Keep the question coming, keep the comment coming, and keep watching. So I'm going to see you guys next time, and have a wonderful evening. All right. And then goodbye.